Hey, I'm Melissa Martin and I'll be presenting a PowerPoint presentation on feline diabetes. The purpose of this presentation is to provide information about feline diabetes and make people aware of the effects of diabetes on cats. This is what I'll be discussing. We'll talk about what feline diabetes is, what the symptoms of feline diabetes are, what are the causes of feline diabetes, what is the difference between type 1 and type 2 diabetes, what are the treatments of feline diabetes, and what happens if feline diabetes is left untreated. So here are some of the symptoms of feline diabetes. First, we have excessive thirst and urination. If you notice your cat is drinking excessively or going to the bathroom a lot, maybe you should take time to consider taking it to the vet. If it has a sudden loss of weight due to the body's inability to handle, or it appears to be vomiting for no reason, it has a loss of appetite, especially if it's been eating the same food forever and then just suddenly loses interest, or if it appears weak, not getting up as much as it normally does, or if you notice that it's not going outdoors or walking like it usually does. If it has poor skin and coat condition, the hair will look kind of grungy and just be kind of nappy looking. And if there's breathing abnormalities, that's if you notice heavy breathing, shortness of breath, all of these could be symptoms of feline diabetes. Some of the causes of feline diabetes most people think that, contrary to popular belief, diabetes is not caused by the excessive feeding of excessive amounts of sugar-containing foods. Some people associate sugar with diabetes and think that that's what causes it, but it's not. The result of overfeeding, which leads to obesity, has been shown to predispose cats to the development of feline diabetes. And obesity is the #1 cause of diabetes, but genetic makeup also plays a role. The difference between type 1 and type 2 diabetes are: type 1 diabetes is caused by insufficient productions of insulin by the pancreas, and type 1 diabetes usually needs insulin injections to be controlled. Type 1 diabetes is the most common diabetes in cats, and 80% of cats have type 1 diabetes. And there's really no treatment other than insulin for this type. Type 2 diabetes is usually related to the body's cells' inability to handle insulin's efficiency. And it's usually controlled by diet and exercise, so it's not as advanced as type 1 diabetes, and it usually can be controlled, but sometimes type 2 diabetes also has to have insulin injections, but that's usually rare. Here are some of the things that could happen if feline diabetes is left untreated. First, there's diabetic ketoacidosis. That's a condition that if diabetes is being treated but not being treated properly the way that the veterinarian prescribed, then it could lead to ketoacidosis, which we also have a breakdown of complex proteins in the liver, which damages organs by not being treated properly. It could also lead to coma and then eventually death. The reason I chose this topic because my cat, Funny, had feline diabetes, and it was an interest to me. Funny was a cat, he just showed up at our house one day as a kitten. He was always a playful, funny little kitten. That's where he got his name, Funny. But later, when he was about 4 or 5, we got him neutered, and he gained a large amount of weight, which is typical of cats being neutered. So he gained weight and became lazy, so we didn't think anything of it. So after a while, he just started losing some weight, and then he became weak, and then he just started laying around and not doing much of anything. So we took him to the vet, and the veterinarian just had said that he had diabetes. When he had to be put on insulin 2 times a day, and he was weak and he just wouldn't eat and all of that. So it took about a month before he recovered fully, but he was never really the same. He just had kind of a strange look in his eye and just wasn't playful anymore. So the diabetes takes takes an effect on cats. But the insulin did help. He did bounce back a little, but he was never totally the same. If you have any questions on feline diabetes, I would be more than glad to answer them. Just send me an email and I'll try to answer any questions that you have. These are my works cited. The works cited that I looked up were they had a lot of information pertaining to feline diabetes. If you're just looking for general knowledge of feline diabetes, these works cited were very beneficial, but they're not made to diagnose your cat with diabetes. It's best to see your veterinarian if you think your cat may have any of these symptoms of diabetes or anything described in the presentation. Thank you, and I hope that you learned something about feline diabetes, and thank you for listening.